New research shows many Americans with depression and anxiety feel mental health medication treatment is still one size fits all. Here to discuss why more patients are seeking personalized care and how genetic testing may help inform treatment decisions is board-certified psychiatrist Dr. Crystal Nelson. Doctor?
Mental health care treatment is highly individualized. What we know is just what works for one person may not work for someone else. Yet patients feel like their treatment is one size fits all. In 2026, the GeneSight Mental Health Monitor survey showed us that 88% of patients diagnosed with depression and or anxiety felt that they would feel more confident in their care if it were more personalized. So we know that personalization really matters because symptoms, medication responses, side effects, this can vary so significantly from person to person. So if we begin to customize and tailor this approach, we can hopefully just get better overall treatment experiences. Well, currently, what we have is a very long, frustrating trial and error process when choosing medications. Again, that survey showed us that 13% of patients that had previously been treated with medication said that only 13% said that first medication worked for them. So a simple test like the GeneSight test, which is a simple cheek swab that the clinician can order in their office and get information back on how the patient's genes might impact the medication responses, can again begin to tailor this to a much more personalized approach. First, it's really important, of course, that a patient have an open and honest conversation with their healthcare provider, communicating with them whether or not medications are working for them. A patient should never attempt to stop or manage their medications on their own. But a patient can hopefully feel comfortable if something like a pharmacogenetic test like GeneSight is appropriate, that they ask their clinician to order this. Also, they could go to genesight.com where there is a guide to give them some help on how to approach this conversation if they're hesitant to have this with their clinician. So, first, of course, always your healthcare provider, but also you can go to genesight.com for more information on this test and how to get started.